Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal. Today I would like to talk about EMDR therapy. EMDR therapy or EMDR psychotherapy is considered to be an integrative model of psychotherapy. It could be used as a therapy for say, or in integration with other therapeutic perspectives, and we will talk about it further. So initially, EMDR was developed by Francine Shapiro, who unfortunately passed away recently. EMDR stands for eye movement desensitization and reprocessing. EMDR initially had an influence or was influenced by the behavior therapy and the work of Joseph Wolpe, as other concepts from psychoneuroimmunology. And the reason that EMDR had those influences was by the life history or the life story of Francine Shapiro. If you don't know, Francine Shapiro was in the 70s. I think it was in the 70s. She was taking a doctor in English literature. So initially she wasn't a psychologist. As she was doing that doctoral work, she found out that she had cancer. And when she found out, she developed an interest on behavioral therapy and processes that could psychological process that could influence neurology and the immune system, such as that in a way that what doctors couldn't explain is that the cancer was in a remission. It was in remission, not only because of the treatments, of course, but also because something was going on in terms of internal processes that were facilitating the remission of the cancer. And in one day, such as the story goes, on the origins of EMDR, Francine Shapiro was taking a walk, and in a certain at a certain point she noted that her thoughts were her negative thoughts weren't that strong. The negative thoughts weren't as impacting, as strong as they were before. And when she started to think about it, or what happened, she realized that as she was thinking or as she was contemplating on those negative thoughts, her eyes were moving rapidly in a diagonal way, as rapid eye movement, or REM, when we sleep, when we are in the stages of sleep. So as she was doing that, it seemed that the negative thoughts and certain physical aspects were changing, were not that strong as initially. So when she realized that, she started to investigate the process. With initially it was called EMD, so DR didn't exist at the beginning, and she decided to go into a master's and a PhD on clinical psychology, so she could formally get an education as a psychologist to do some research on that phenomenon. So initially, she called eye movement desensitization, when she realized that the process had certain similarities with the work of Joseph Wolpe, namely systematic desensitization. Sorry for my pronunciation. Where in behavioral therapy you focused on a certain behavior and you progressively desensitize yourself to those fears. If you know the process of systematic desensitization, you developed an hierarchy of fears, and you start with the thing that less frightens you to the worst fear. And in that process, you systematically desensitize yourself to that fear through, obviously, visualization techniques and other processes. In a certain way, Joseph Wolpe, initially, when he developed systematic desensitization, he utilized certain hypnotic processes. So, integrating those works, Francine Shapiro conceptualized what was finally developed as EMDR, because one of the objectives of Francine Shapiro was not only desensitize the intensity of the thoughts or feelings or behaviors, but also reprocessing traumatic events or traumatic memories or traumatic feelings, because initially EMDR was conceptualized as an intervention for PTSD or severe stress or severe anxiety, and that is the brief history of EMDR. So EMDR has certain principles. For example, bilateral stimulation is only one component, one integrated component. A lot of people associate EMDR only because of the bilateral stimulation. That is the most obviously, the more obvious and the more observable process of MDR. But EMDR has a lot of phases. So this is one principle. In EMDR, the therapist focuses the attention on images, beliefs, emotions, physical responses, and awareness, more awareness, and internal balance, resiliency, and interpersonal systems. So there are a lot of things that the EMDR therapist focuses as a principle on his intervention. And also, therapists must use different EMDR protocols depending on the pathology that presents themselves, as such as EMDR therapists have to adapt the proceedings specifically to the client's characteristics, not only for the pathology. And the purpose of EMDR is to free the client of the traumatic past into a healthy present. So in that sense, EMDR has a lot of inspirations. For example, you can see certain aspects of psychoanalysis in the sense that you regress into, or you dealt with traumatic childhood memories, behavioral therapy, obviously on the focus of the awareness into behaviors. You have client client-centered therapy, a Rogerian principle that EMDR focuses on the client as a person, not only to the client, but also in their affects, in their feelings, and in an experiential way. In that sense, you have not only client-centered therapy, but also certain principles of emotion-focused therapy or other experimental therapies. And finally, cognitive therapy, where you can, when you can focus on self-criticism, positive and negative self-criticism, which cognitive therapy works on that aspect into cognitive restructuration or other techniques. And finally, physical responses. EMDR realizes that a lot of traumas can attach themselves into physical responses or physical behaviors. In a sense, it's the work of Basil van der Berg, I think, van der Berg, Basil van der Berg, and all that traumatic research field. As I said before, EMDR has eight phases. So in the first phase, or phase number 1, you have the client's history and the planning and the intervention, the intervention planning. So in the first stage, you do an interview where you explore the client's history, and also you align with an intervention plan where you can discuss that plan with the client, obviously. On phase 2, you have preparation. In that phase, the EMDR therapist establish the working alliance, the therapeutic relationship. He explains what is MDR, what is the MDR process, and eventually he explains or he clarifies certain myths or misconceptions that people have about EMDR. So and that's phase 2. In phase 3, you have the evaluation phase. In that evaluation phase, you target traumatic feelings, thoughts, and behaviors in a way that you measure them. So it's common in EMDR protocols. You establish a 0 to 10 scale. It's a scaling process where you ask the client to attribute a measurement into their negative thoughts or feelings or traumatic incidents. So EMDR will focus on reducing that subjective measure into 0. The objective is to eliminate that traumatic incident or that traumatic memory or that traumatic feeling or cognition, reprocessing them. So that's the evaluation phase. And in the fourth phase, or phase 4, you have desensitization. That specific phase, you have those bilateral stimulations. So nowadays, a lot of EMDR therapists, they do a bilateral stimulation utilizing machines, or utilizing sounds, or utilizing images, or whatever. Initially, the bilateral stimulation was asked to the client to focus their attention on the fingers, and to target them, or to follow them when the therapist did those kind of movements. And as the therapist do these kind of movements, you focused on the feelings, or the self-criticism that you internally do. You externalize those kind of dialogues, internal dialogues. So, for example, I'm weak, or I'm not that strong, or whatever. In phase 5, or the 5th phase, you have the installation. In that phase, you install what is the positive, or the reprocessing stuff. For example, you reprocess thoughts or feelings into more positive ways, positive affects, positive cognitions, whatever. So you install what you want to reduce the negative side of those traumatic instances. And in phase 6, you have what is called the body scan. So focusing on those cognitions, not only the negative side but also the positive side, the therapist asks the client to mentally scan her or his body, so he or she could be aware if in any point of his or her body he or she feels something wrong, or something of a discomfort, or if she or he feels positive feelings, or positive behaviors. In phase 7, you have the closure phase. So it's the final step of the intervention, where you consolidate, or you solidify the changes that could occur in the session. And finally, in phase 8, you have the phase of reevaluation, in a sense that you, via feedback, you evaluate if the intervention was successful, or if the intervention could take a little longer. It's important to say that Francine Shapiro established that in these phases, the number of sessions could vary depending on the client, and depending on the situation, the pathology that the therapists are presented to. So it's not a rigid number of sessions. It could vary. It's important to say that. Finally, EMDR is an empirical research model. Initially, EMDR was research utilizing RCT, so randomized controlled trials, for post-traumatic stress disorder and severe anxiety and severe stress. So EMDR is well established as an intervention, a successful intervention for stress, post-traumatic disorders, and all those kind of things. Nowadays, EMDR is integrated and explore into different pathologies such as depression, eating disorders, phobias, etc. And there is a body of research into other pathologies, and it's important to say that everything that I said in this video was based on what initially Francine Shapiro conceptualized as EMDR, because nowadays there is an evolution on EMDR therapy, EMDR thinking, and EMDR research. So a lot of things that initially Francine Shapiro proposed to, nowadays they are different, or they could be different. So it's important that you realize that EMDR is in constant evolution or constant growing. Something that I didn't said, and I'm not going into it, is the thing that is the idea that EMDR is a psychotherapy model or is a therapy model per se, or it's an approach. There is a conflict, a dilemma, a discussion around those questions. For example, in Portugal, EMDR therapy is considered to be a psychotherapy model for self. So it's a discussion that I'm not going into it because it doesn't go anywhere, and a lot of research has validated MDR, but a lot of research proposes that EMDR could not be so efficient, so efficacious. The efficacy of EMDR isn't as much as certain research papers concluded. So take that with a grain of salt. As usual, I will link a certain reference so you can explore, so you can better explore what EMDR is. And please explore, because EMDR is an interesting approach, whether you consider to be a psychotherapy or a therapeutic approach. As always, thank you for your time. Thank you for being there. I wish you a good week. Stay safe, stay healthy, and I'll see you next time.